Tonight on Mississippi Insight, COVID-19 cases reach their apex in Mississippi, topping 3,000 and rising. The governor shuts down schools for the rest of the school year and makes a decision on whether to extend shelter in place while unveiling new programs to help those impacted, mortgage assistance and emergency child care. Tonight, we are addressing the disparity in cases along racial lines. With so many more African Americans contracting the virus, we look at the underlying issues with the national president of the NAACP. We're talking with Derrick Johnson. And don't get scammed during the pandemic. The state auditor tells us what to watch out for. Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. Tonight, the focus once again is on the impact of COVID-19 as Governor Tate Reeves makes an announcement about the shelter-in-place order.
I made a vow to protect the people of Mississippi. I have to do what the best information and wisdom I have tells me to do. Right now, it tells me I have to ask you for one more week. One more week of vigilance. One more week of sheltering in place. It's working. It's working as a temporary tool. It has to work for one more week, and then we can begin to reopen our state. I'm looking at every number. COVID-19 infections, COVID-19 deaths, as well as unemployment figures. And they tell me this is the best course of action at this moment. We need one more week. Then we will be through our peak use of healthcare resources and able to start the process of reopening Mississippi. Remember our goal. We cannot stop the spread of this contagious virus. We can slow it down, and we can get through the worst part of the cycle. We can prevent our healthcare system from being overwhelmed. We are growing more and more confident that we have flattened the curve to the point where victory is within reach. We need one more week to break the back of our enemy.
Governor Tate Reeves also announcing that all public school buildings will be closed for the rest of the school year, encouraging schools to take steps to help students who have fallen behind catch up. The governor also announcing 2 new sites to help those impacted by COVID-19. The Mississippi Home Corporation authorizing temporary help for mortgage holders having trouble making payments. For more information, go to mshomesaver.com. The Department of Human Services is also establishing a program to help essential workers with child care. It's called Child Care Crisis Assistance in Isolation Response Plan, or C-CARE. It helps people establish temporary emergency child care in a non-traditional setting. For information or to apply to be a C-CARE provider, go to the mdhs.ms.gov/CCAIR. We have talked about the racial disparity in COVID-19 outbreak. More than half of all cases are in African Americans and more than 2/3 of all deaths. To talk about the underlying issues, I'm now joined via Zoom by Derrick Johnson, the national president of the NAACP. First off, how are you managing this outbreak, Derrick?
You know, this is a new normal. I think most Americans have realized the importance of social distancing. I am doing the same here in my home in Jackson. As we also monitor the impact the spread of the virus is having, not only on the general society, but particularly the African American community.
The figures I just quoted are from Mississippi's Department of Health, but this racial disparity issue is not a Mississippi problem. This is repeated places all over the country, like New York and Chicago in particular. Why are we seeing this, or what do you think is the main cause of all of this that we're seeing here, particularly in African Americans?
Well, there's several factors. You have a pre-existing issue, medical issues with many African Americans. You have structural deficits. The state of Mississippi, like most southern states, refused to expand the Affordable Care Act. Therefore, many African Americans lack access to health care. You have persistent poverty and the lack of the necessary support to ensure that quality food is available to all citizens. So what we're seeing now is a pandemic on top of a longstanding medical crisis we've seen in this nation and in the African American community.
Well, Dr. Anthony Fauci said earlier this month that we really do need to address the health disparities that exist in the U.S. What particularly do you think needs to be done, and what do you think is going to happen going forward once we get past this?
Well, access to health care is critically important. For far too long, we fought against making sure that all citizens had quality access to health care. It's unfortunate that we are the only developed nation that denies citizens quality health care. It is something that civil rights workers fought for in the 60s. It's something that we are still fighting for today. And I hope at some point policymakers see the value of a healthy society and stop the ongoing politicizing the need for quality health care.
Do you feel that there's a momentum for a change when it comes to access for health care because of what's going on right now?
Such a unique time where we're still hearing people putting profits over people. Just earlier today and yesterday, there were all calls to reopen our economy, despite the fact that people will suffer and die. We had one U.S. senator, I was watching this morning, was saying that, the American people expect some people to die. That is the most inhumane statement I've heard. We really need to start valuing the quality of human life and individuals and stop putting profit above people.
What about, there's also talk about many of the African Americans and people of color have been working on the front lines, working in the grocery stores. They are the people who are also picking up the garbage and everything, and they can't shelter in place. How important is that part of the issue?
It's an extremely important issue. If we deem certain work essential work, we should provide essential equipment for individuals to protect themselves. We've seen a plant in North Dakota to shut down. There's a food processing plant. 50% of all cases happen in that plant because individuals were deemed essential, but yet they were not provided the necessary support to continue the work and be safe. If we take out our workforce, how can we function as a society? And we must value workers and not demean the quality of work and expose workers to health hazards.
What is your message to African Americans and people of color as far as protecting themselves and about this virus?
A couple of things. One, please practice social distance. It's important to stop a virus that there is not yet a cure for. There's not a complete understanding how it's contracted. But what we do know, the states and the jurisdictions that took it serious enough, we're beginning to see a decline in the number of incidents, a decline in the number of deaths. I'm concerned for a state like Mississippi that took far too long to take this virus serious, that we're still looking at the potential of more people contracting, more deaths. So we must make sure that we social distance. Secondly, the underlying health issues that affect our community. The high rates of asthma is a part of social determinative. It's the environments we live in, so we have to figure out ways to change the environment. In many ways, the underlying issues of diabetes and other things. Let's be more aggressive to ensure that we get the necessary support from our community health clinics if you don't have health insurance, so our underlying issues don't contribute to a higher rate of fatality as a result of this virus.
As the NAACP as an organization, what are you all doing as far as, are you communicating with lawmakers, or what are you all doing as far as when this issue is coming about, dealing with lawmakers? Well,
we are having direct communication with federal lawmakers. Congressman Thompson here is one of the leaders in Congress in D.C. Ongoing dialogue with him and Congressman Clyburn and members of both House and the Senate. In addition to that, we are regularly convening our members across the country, 2,200 units in 47 states, on conference calls and other platforms to inform and educate them with medical health experts. Just last night, we had mental health experts and medical health experts on a conference call with close to 30,000 people on the call just to provide timely information. The role of the NAACP is to make sure we get medical sound advice to communities as soon as possible, as opposed to the lacking of leadership that we're seeing with politicians giving political advice, not medical advice.
I know there's a debate in Washington about opening up the economy or dealing with the health of Americans. What is, when you look at the economy and a lot of people who are suffering economically, where do you go there?
But we have to be clear what's the goal. Are we going to put profits above the health of our nation and people? Or are we going to see people as expendable and say, let's open up an economy knowing that we have a virus that's amongst us? There have been more people killed by this virus than was killed during 9/11. We must take this serious and adjust our functions in a way in which we can care for people, provide the necessary support, and be able to pivot out of this reality more sooner than later with the right medical advice. Individuals driving the stock prices should be informing where we are in a medical crisis. Medical professionals, health professionals should be determining the policy of this nation in this moment of crisis.
And for those who argue, what do you say to those people who can't pay their rent, can't buy groceries and feed their families and are struggling there? What would you say to those folks who say, hey, we really got to get things going?
But we have to create a stronger safety net. Those are the very same people that work every day. Those are the people that picking up, the sanitation workers that picking up our garbage, working at the chicken processing plants. They're doing the grunt work that many of us depend on. So we need to value their ability to survive through this moment and provide the proper safety nets. They're not looking for a handout. They're looking for an opportunity to exist in this economy. Many corporations have received handouts, but we're not valuing the individuals that make the economy go, and those are the workers who go to work every day.
A lot of African Americans have small businesses. What do you say to them who might need help to stay in business when this all passes through?
Well, I mean, we are in an inflection point here. This pandemic is not, it didn't come out of thin air. This is a man-made pandemic. This is the result of policy decisions that individuals made, particularly coming from the White House. And those small businesses, this is not their fault. And we should make sure that they can survive through this. This is a man-made pandemic because the president refused to heed sound medical advice and all the warnings that was provided early enough that we could have avoided this.
Where do you see us 6 months from now?
Embracing a new normal. I don't think we can go back to what life was in January. A good number of us have begun to telework. Society has evolved. I hope that there's not a second wave in the fall as being predicted. And I'm hoping that at some point, our medical health professionals are able to really predict and contain this virus in a way in which we can get to a level of society where we're not under this critical health risk.
Do you see the economy opening up in May slowly like the president wants, or do you see it pushed back until maybe June or July?
Well, many of the governors across the country will determine that whether or not the economy open, whether or not people are moving. In many ways, that's the decision and the sole authority of governors across the country, not the president. So we will see how governors will react. My concern is you take a state like California, who begin to see a drastic change in the numbers, and they have really controlled it. They jumped out early enough. But if you open up all the states, California will be just as much at risk as we're beginning to see. Florida is now becoming one of the hot spots. This is a national pandemic. It requires a federal response that is sound and data and information driven by health professionals. And until we get to that point, I don't think we're going to see a true economy opening up. I think we're going to see a bunch of false stars and more people being placed at risk.
Are you communicating with Mississippi's Governor Tate Reeves? Have you been talking to him about what we should be doing here in the state?
I have not spoken to the governor of the state. I have been really focusing on the national landscape and making sure our members are informed and working with members of Congress around the federal response.
All right. Derrick Johnson, National President, NAACP, we thank you for joining us and talking to us, and we look forward to hearing from you soon. Thank you very much for joining us.
Thank you for the opportunity.
All right, thank you very much. When we come back, how to avoid becoming a victim of scams. Scam artists are hard at work during this COVID-19 outbreak, and there are many ways you could easily become a victim, whether it's fake testing or people targeting your stimulus checks. We talked with Mississippi State Auditor Shad White about what you should watch out for.
See, fraud is more common, unfortunately, and the reason is that people are trying to prey on your fears. They're trying to prey on your anxieties about what is going on, and they're trying to use this moment, the moment of the emergency, to benefit themselves financially. So in the state auditor's office, we've seen a number of different fraud schemes. I'm a certified fraud examiner, and of course, certified fraud examiners are trained to look out for those sorts of schemes. So we've seen a variety of different schemes. Different schemes are reportable to different law enforcement entities. So part of what I wanted to do this week was inform the public about what those schemes are and what's going on out there, but also tell people where they can report those different schemes based on what they're seeing. We have seen that fraud schemes during this time, during the pandemic, are targeted specifically to the elderly many times. And so that's of a huge concern to us. Anytime we see sales pitches or marketing directed straight to the elderly, I think it's important to treat that as a red flag, to treat it as something that is potentially fraudulent, and to do our homework and use common sense before we give any personal information or open an email when we see that kind of a sales pitch. So one scheme that we've seen in particular is folks will use social media and contact people via social media, tell them that they can get them stimulus checks if they would only provide their bank account information. So that's one example of stimulus-related fraud that we're seeing through the internet right now. You should know out there, if you're waiting on your stimulus check, that information about the stimulus should come straight from the IRS. And if you see any of these schemes, the best place to report that kind of a scheme to is called the National Center for Disaster Fraud. It's a center that was set up by the Department of Justice in Washington, D.C. Another thing that we're seeing out there, unfortunately, are schemes involving fake cures or fake protective equipment. That sort of a scheme, if you see something like that, you can also report that to the National Center for Disaster Fraud. Some other schemes are a little bit rarer, and those get reported to different entities. So, for example, on the internet, we've seen people trying to convince other folks to buy stock in their company, and these people are claiming that they have discovered a cure to COVID-19, and so their stock is about to take off. That's usually what we call a pump and dump scheme. That's where a company tries to pump up the value of their company and then dump their shares after you've already bought. That sort of a scheme could be reported to the SEC, the Securities and Exchange Commission in Washington, D.C. You have to be vigilant right now. You have to use common sense, and you have to be on the lookout for these things.
We'll be right back. And now, Walt Grayson.
Well, have you ever kicked a fire ant mound and watched the ants right after? All of a sudden, they're everywhere, going all directions, all at one time. Now, this may look like random activity to us, but there's a purpose: rescue and repair. And protection, too. They'll sting the fire out of you if you just stand there. Now, that reminds me of people right after a disaster like the tornadoes that hit Easter Sunday. The rain hadn't even let up before neighbors were out helping neighbors dig out. Road crews, or just people with chainsaws, were immediately clearing the highways, and then power crews were already surveying down power lines. This reflex response to disaster transcends racial and socioeconomic lines, too. It just ends up being people helping people, bringing what you know to the game to help everybody across the finish line. And when you think that all of this rapid response was encapsulated in the other disaster going on right now, the more slow-motion coronavirus crisis, you draw some comparisons between the two. Now, whereas with the tornado, the appropriate response is immediately evident, with the coronavirus, it's more subtle, but it's just as real. Lives are just as at risk, and people's property and livelihoods are at risk also. We can't take a chainsaw to the coronavirus, but then on the other hand, there are still things we need to do, like wash our hands, and stay away from other people as much as possible. Distance is still the best vaccine. And be aware that just as a tornado leaves scars that will take years to heal, This coronavirus, although more subtle and a lot quieter and not nearly as fast, will leave long-lasting scars also. Now, we'll have neighbors who will need a helping hand to make it across the finish line for quite a while yet. Let's don't quit early. Let's don't let each other down. If our ants know how to work together through a crisis, surely we do. I'm Walt Grayson.
Thanks again to NAACP President Derrick Johnson for joining us, and to you for watching. For Walt Grayson, I'm Byron Brown. Join us again next week for another edition of Mississippi Insight. Until then, make it a good night.